Welcome to ETMCTV and this informative presentation by Arlene Green, licensed chemical dependency counselor and program director of the Inpatient Chemical Dependency Unit at ETMC Behavioral Health in Tyler. Ms. Green will be discussing inpatient chemical dependency treatment for adults.
There's no face to addiction. There's no face to addiction or abuse. It's not something that someone chooses. People use for all different reasons. Addiction is certainly one reason. Addiction is proven to be a disease by the American Medical Association. There also may be mental issues that they need assistance with, and we would treat those at the same time. There's genetics involved when it comes to actual addiction, but anybody who uses a potentially addictive substance and continues to use that over a period of time is going to require detox when they try to withdraw from that substance. That doesn't make that person an addict. It just means the body is taking care of itself and building up a tolerance level to that substance. We're not going to label them an addict. That's just someone who needs a medically supervised detox, which we also offer. We're not interested in labeling anybody. We are interested in giving somebody a proper diagnosis and getting them stable and getting them on the right path. Each person is truly an individual. We're going to treat that patient based on their individual needs. I think that's so important. I think that's what sets us apart from other treatment centers. We're not just a regular treatment center. We take it individually, your needs, your situation. The first step is an initial assessment, and then you are seen by a psychiatrist who does an evaluation. There's medication management, which includes detox protocol if that's necessary. And then there's different types of therapy. There may be individual therapy, family therapy, and there's groups. You are expected to attend or participate in your treatment. Average length of stay is approximately 2 weeks, but it is individualized. It depends. A lot of factors are involved. Types of drugs that you've been taking, your detox protocol, and what your needs are. It is individualized. It's an entire treatment team. It's not just one person. It's not just the doctor. It's not just the nurse. We all work in unison. We all work in unison. It's a holistic approach. We have our chemical dependency outpatient program that's available as well. That can be entered into after you get out of intensive treatment, or if you don't need intensive inpatient, as in detox, you may go directly into that program. Recovery requires work. It's not someplace you just go and you have recovery down and walk out and that's over with. So it's a lifelong journey, and you need help in that process. You need a support system that understands where you've been, what it's like to have cravings, what it's like to deal with life on life's terms sober. That's not necessarily an easy thing to do. You are not used to dealing with life sober. You're not used to dealing with crisis, jobs, relationships, sober. That's a whole nother ballgame. We help you begin that journey. You don't just learn what you need to learn in the short period of time that you're inpatient. Aftercare is vitally important. We have excellent aftercare programs dealing with chemical dependency and also dealing with mental health illnesses. Treatment teams meet on a regular basis, regular scheduled basis, to go over your treatment plan and note your progress and update your treatment plan as noted, as necessary. Often patients will come in and common complaints or symptoms that they report are loss of jobs, loss of family, loss of health, loss of their finances, standing in the community. The personalities are changing. Appetite and weight is changing. There's fluctuations in behaviors from one extreme to another. These all can be signs and symptoms of some type of substance abuse and or mental health issues going on. We never know when you're going to be listening to this and want help. That's when we want to be available for you to meet your needs. We have a 24-hour call that you can call us, and trained licensed available staff will will talk to you. You can set up a screening, or you can talk to them at that time. Asking for help can seem very frightening and overwhelming, but just recognizing that you have a problem is the first step. Maybe you've been in treatment before and haven't been successful, but you have gained knowledge, and using will never be the same for you because you have that knowledge. So you've taken some steps towards getting better. Thousands before you have maintained sobriety and learned to enjoy life sober and replace feelings of shame and guilt and hopelessness with a sound mind, body, and soul. And that could be you too. We're not just another treatment center, and we'd like to show you the difference. But you have to call us. Take that first step.
For general information about ETMC behavioral health or to make an appointment, please call 903-266-2200 or visit etmc.org and click on Behavioral Health. To speak to a mental health professional any time of day or night, call the 24-hour crisis line at 566-0088 in Tyler and 1-800-566-0088 outside of Tyler. ETMC Behavioral Health is an in-network provider for Medicaid, Medicare, and most insurance plans.